Hi everyone, this is Andre. Today we're going to talk about a case of cough. So a couple months ago, there's a patient who had been coughing for about a month and couldn't resolve it, so she came to see me. Back in my home country, there's a saying that doctors are afraid of treating cough. The reason being that when somebody is coughing, it's very irritating for that person, and if the treatment is not effective, the person can be even more irritated, and especially when the cough is affecting your sleep. Like a lot of times when people are coughing, as soon as they lie down, they start coughing more, or when they're sleeping or at night and they're coughing more. And when you cough, or when your kid is coughing, you probably cannot sleep at all. So it's not a terminal illness, but you will wish that you could die from all the coughs. The reason cough is difficult to treat is because for us, our treatment are based on the syndrome or pattern differentiation. But when you're coughing, there's not too many symptoms or signs associated with it, and that's why it makes it more difficult to differentiate what type of cough this is. And plus, in Chinese medicine, every single organ can cause cough. For example, there's lung cough, there's stomach cough, liver cough, kidney cough, large intestine cough, small intestine cough, bladder cough. Any combination of the organs can make a person cough. So that's why it's very difficult to differentiate and very difficult to treat effectively. However, in this case, I wanted to demonstrate that sometimes when the patient is coughing, it's not just one medicine treats. One medicine will get rid of the cough completely. Sometimes you have to break it down to two stages, because there can be an acute factor in there, and also as well as a chronic factor in it. The combination can make a person cough for a long time. So this patient is a new patient, so without knowing too much history of her health, and the only thing I could do at the first visit was treat her cough, assuming it's a acute condition and it's being brought on by can be virus, or she had a cold, things like that. So let's take a look at her chart. So female, 54, she a dry throat and cough. So whenever she felt like her throat is dry, she would cough more. So if she's talking continuously, that would cause dryness in her throat. She would start to cough, or anything that causes dry throat, she would cough. For example, some food that irritates her throat, she would cough, and she would try to drink water to kind of rinse her throat, but it's not very effective. And let's look at her other part of the chart. So appetite, she only eats small portion. So I kind of dug into that. She said that she does feel hungry. She has normal appetite, but as soon as she ate a little bit stuff, she would feel very full, and she would she'll feel very bloated. So this type of, or when she got hungry, she didn't want to eat at all. So this is a very interesting symptom that's we're gonna explain later. This is very key factor in treating her cough. The second part of her is her water intake. So she likes warm water, so cold water makes her cough more, and she felt there's a phlegm that kind of stuck in her throat. She wanted to cough it out, but it couldn't get out, or she would try to drink water to rinse it out, and that doesn't go down either. So another important symptoms for us to differentiate. The third part is her temperature. She tend to be aversion to heat, so she's more sensitive to heat and cold, so she feels hot sometimes, and her hands and feet are warm. But energy and stamina wise, she felt okay, but she couldn't lift heavy objects. And bowel movement, it's a little bit more dry, and she gets abdominal pain quite often. So when I take a look at her tongue, so this is a representation of her tongue. So this shaded area is basically the tongue coating. It's a very interesting shape. We call it geographic tongue. So meaning the coating looks like a map on the globe, or on a map, basically. So it's missing chunks compared to a normal tongue. A normal tongue would have all the coating distributed evenly without missing out chunks like that. So generally, when a person has geographic tongue, it means this person, it probably indicates that this person has yin deficiency. So if you're not familiar with the Chinese theory, yin being the opposite part of yang, so you heard of yin and yang, and they are one to represented as light, the other one is represented as dark, or you can find anything that's completely maybe like fire and water that could represent that. So yin and yang in Chinese medicine, on applying to our body, yang would be more like like heat and warmth and temperature, and as well as function. So for example, if this person is lack of yang, we call it yang deficiency. It can mean this person are generally very cold. This person's body's temperature is lower and he feels cold all the time. Or there's yang deficiency as meaning the functional part of a certain organ. For example, if somebody has a stomach yang deficiency, it can mean that the structural of the stomach looks perfectly healthy. However, it's just not function. It's not function properly. Kind of like you have a motor, it looks fine, everything, but you kind of plug it in, it just doesn't start. So that's the meaning of the functional deficient, not functional. Anyways, so yin being in Chinese medicine, that would represent the structural part. So for example, the motor, you can see the structural are sound, and it's looking fine, it's normal looking, you cannot see anything wrong with it by looking at it. So that's the yin. And yin also has another meaning of has representation is called the fluid. Yin can be also fluid as well. So for example, in a motor you have some lubricants, or you have oils to lubricate it. So this yin deficiency meaning that it's missing part of the oil or part of the lubricant. So by looking at the tongue, you can tell that there's some part of her body is missing what I call yin, is missing lubricant or missing fluid, and part of it has too much fluid. So one part having too much lubricant, and one part having no lubricant at all. So remember when I said her appetite, she only eats very small portion, or she gets hungry but she didn't want to eat, or she got hungry but she could only eat very little and gets full right away. That's a very typical symptom of somebody with a stomach yin deficiency. So meaning that in the stomach, maybe in the lining, there's not enough fluid in one part or not enough mucus. Basically, it's the liquid or mucus part of the stomach that's missing, and also they're part of the stomach that has too much of these fluid accumulated there. So and also based on her other symptoms like dry cough, dry throat. So dry throat, you can see it's missing lubricants, missing fluids in your throat. That's why she was coughing. So when she came to visit me, she couldn't talk for very long. If she talks for too long, she would start coughing, and she would need to drink more water, kind of to rinse a little bit to able to continue to talk again. And this type of yin deficiency type of person tend to feel more hot. Like her, she's a little bit more aversion to heat, so she feels a little bit more hot, but there's no cold sign in it. And then based on her health condition, I gave her a formula. It's called Mai Men Dong Tang. So I'm not gonna write it down anyways. So it's a formula to help her regenerate the missing lubricants and the missing fluids or mucus in her stomach. And with that formula, I gave her that formula for a week. One, to treat her condition. The second was to also kind of do a little bit of test, see if her cough is 100% coming from this issue. So if after a week of taking this medicine and her cough is completely gone, then her cough is 100% based on this issue. If her cough is not completely healed, then there's some other factors that I need to reconsider. Maybe it's from her body constitution, so she has also other issues with her body. Maybe there's a kidney deficiency, there's other issues that has been with her for a long time, but the first visit I could only assume that this cough is more of an acute type of cough, and is affected by a sudden onset or whatever the external pathogen, such as virus, or she had a cold or something, or flu. So after a week she came back. She said her throat is much better, is less dry, even though if she talks too much she would still cough. But her appetite is completely back to normal. And when I checked her tongue again, her tongue went back to normal. She no longer had a geographic tongue. So it means that now this formula can address all these issues I was talking about earlier. But her cough was only about 50 to 60% resolved. So meaning the rest 40-50% is based on other stuff. There are other factors in it. So that means I have to address her body constitution as well. So when I checked her pulse, her kidney was a little bit weak. She could not lift heavy object. These are all indication of kidney deficiency. And there's also another important symptoms here. It's having phlegm stuck in the throat. So if you have some sort of phlegm or something stuck in your throat, you try to cough it out, but you couldn't, or you try to drink water to wash down and you couldn't. And it's very typical symptoms in Chinese medicine. So the formula I gave her this week was a combination of to help her with her throat, because when she talks, she would still cough. And now I want to address this phlegm stuck in her throat, so I gave her Banxia Houpu Tang, which is a very classic formula to address that, plus Jinkui Senqi Wan, which is a formula to address her kidney deficiencies. So while she was there, I asked her to take one dose of the medicine and wait for 15-20 minutes to see if she's getting better, because it's important to have a chance to test the formula before patient leaves, because if patient goes home and she took the medicine for 2 days, she was still coughing the same amount as she did, she would not be happy. Like she felt like maybe money wasted, or this doctor is no good. And on the same part, I also felt like maybe I didn't do a good job of looking into her condition and gave her the correct formula. So I asked her to try that, and during the 15-20 minutes of wait time, we were still talking, and she was able to continuously talk without coughing. So that kind of confirmed that this formula works really well for her cough. So I let her take home a week worth of herbal medicine, and she was okay after that. So basically, this case, we kind of involved, there's an acute part and also a chronic part. Sometimes when the condition is, when we address the acute part, it will resolve completely, but sometimes it doesn't. So it's really hard to tell from just the first visit. So it's normal that we see patient in maybe like a few visits to kind of resolve their issue, because sometimes when they are coming for first visit, they forgot to tell us some important information, or they didn't observe what their appetite is like, or what their bowel movement is like, things like that. So we have a question: what is a healthy looking tongue coating? Does it help by brushing it? The healthy tongue coating, so like I mentioned, it should be evenly distributed on the tongue. It should be kind of thin and white. So a normal tongue would have a pink body, a thin white coating on top. So when you look at the tongue, you can see the white coating, and through the coating, you can see the part of the body color, the pink body color, and that would be a healthy tongue. And for some people, because of their body condition, they have really thick coating, and you will not be able to see the body of the tongue, or the coating can have different color as well. It can be gray, it can be yellow, and more severely can be even black or gray, or very dark. On the opposite spectrum, there can be no coating at all. So meaning that this type of person is lacking a lot of body fluids, that their tongue has no coating anymore. So brushing the tongue coating would help getting rid of part of it. And if you're worried about odors from your mouth, it helps. But however, because the body condition hasn't changed, the coating will come back on the next day, or even in a few hours. So if you want to get rid of thick tongue coating or some odor on your tongue, the best would be getting your health checked by a TCM professional, and have them look at you, see what's causing the thick coating, and help you get your body to become healthier. And once your body is at a much healthier state, the coating will reduce to normal. So that's it for today. It's a little bit of a long case. I'll see you next time. Bye.